The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, D-Truth. What can it do for you? Your presenter, Rebecca Kirby, MD, MSRD.
Howdy. I'm Dr. Rebecca Kirby. I'm one of the doctors here at the center. Our nickname is the Bright Spot for Health. And today, the topic is called D-Truth. What can it do for you? Now, do you guys get the play on words? D-Truth? Okay. Good. Now, in these tough economic times, I have good news. We're going to talk about something that is actually free. Vitamin D comes from the sun. It is the sunshine vitamin. Now, there's a little caveat associated with that free. You may not get enough vitamin D unless you're working on the equator, outdoors, naked in the high noon sun. But nevertheless, you could if those conditions could be met. All right, well, why have we been hearing so much about vitamin D in the news lately? There has been really good research going on about vitamin D for literally decades. But what's happened is it's crept into the medical literature. And therefore, it's getting a lot more notice, and you may have even had your own doctor order a vitamin D level for you, which is great. And some of the things that propelled it into the news was the fact that in these vitamin D studies that were published in a medical journal showed that if people were taking ordinary amounts of vitamin D, what they consider ordinary was on average about 500 IUs of vitamin D, and the range you can see is like 300 to 2,000. They noticed a decrease in total death rates. In fact, it was a 7% decrease in mortality. Then another study put in a medical journal actually looked at folks who had heart disease. And of course, heart disease is our #1 killer in the U.S. So they used subjects that were coming to the hospital for a heart procedure called angiography, and they found that those who had the lowest levels of circulating vitamin D in their blood had more cardiovascular disease, more risk for cardiovascular disease, more deaths from cardiovascular disease, and then more of what we call all-cause mortality, which means literally just death from anything. So obviously there was a protective factor there. And then looking at United States data, they looked at 13,000 adults and found that those with the lowest vitamin D levels had a 26% increase in death, again, from any cause. And one of the newer studies also showed us that there's some increasing risk factors for acquiring a vitamin D deficiency, besides obviously living too far north, but increasing age, being female, non-white ethnicity, diabetes and smoking were risk factors for vitamin D deficiencies, which is sort of a new wrinkle, and higher body mass index. And we'll explain a little bit more in detail about those, but kind of be thinking about your own situation there. Now, again, the sunshine vitamin is vitamin D, and we actually need ultraviolet B. UVB is the nickname, and it turns something into the skin, which is biologically inactive, but it goes to the liver and gets formed into this other compound, which is 25-hydroxyvitamin D. Now, what's important for information about this is the form that's found in the blood. So when you go and have your blood drawn and have it measured, this is what they're measuring, the circulating 25-hydroxyvitamin D, and this is another little nickname for it. You'll see the symbol 25-OHD. OH is a hydroxy group. So that's the chemical shorthand. And then we've always known that in the kidney, this is converted to the active hormone, the 1,25-dihydroxy vitamin D. What we know now is there's other tissues that can do this conversion. The pancreas, the colon, the prostate, and the breast. And what's important about those tissues? Well, we now know that vitamin D can help prevent cancers in those tissues. Okay, now let's talk for a minute about the forms of vitamin D, because when you look at your supplement, it should say cholecalciferol. That's the D3 that we can take. And there is another form called ergocalciferol. That's what plants make. But it's not very powerful. It's not found normally in humans. And it's 3 to 10 times, the actual D3 that we make is much more powerful. It's 3 to 10 times more potent than D2. And vitamin D2 is the only prescription vitamin D. Sometimes folks are put on a 50,000 IU vitamin D, and they go to the pharmacy, and it's a D2 product. So what you buy when you go to the health food store should be a D3 product. I find very little D2 out in like supplements. Sometimes you see it fortified in foods, so check your labels, because you want the cholecalciferol. The D2 is less potent. And the important thing is it's not as easy to detect in your blood. So when you go to get your blood levels of vitamin D measured, you're looking to see how you can optimize those levels, and you optimize them by taking D3. If you're taking D2, you're not going to necessarily see it in your blood levels. Okay. Now, once again, vitamin D is just a fat-soluble vitamin, and as I mentioned, the D2 is made by plants, and the stuff that is manufactured is actually from the mold ergot, and that's why it's called ergocalciferol. And they first patented this back in the 1920s when they discovered vitamin D would prevent rickets, and they started putting it in infant formulas and everything. Now, and as we know, the D3 we actually can make ourselves. Alrighty. Now, here's the tricky part. What does vitamin D do? I got stopped in the hall by someone who asked me, okay, in a nutshell, besides rickets, what does vitamin D do? And I was sort of frozen there for a moment with my mouth open and my little hamster going round and round on the little cage in my brain trying to think. Everything. This is the remarkable thing about vitamin D is it has receptors in many tissues. So there may not be a single tissue in your body that is not affected by vitamin D. And that's why it probably doesn't really need to be called a vitamin. First of all, a vitamin is something that we can't make. Well, we can make vitamin D, so it's not quite strictly a vitamin. And the other thing is it's really like a hormone. It has receptors that they call VDR, which I think is very nice because it stands for vitamin D receptors, so it's going to be easy to remember. But they find that it's in most cells of the body. So that means vitamin D is docking on a lot of different tissues in the body. And this idea that we probably have 50 genes in our tissues that are regulated by the active vitamin D hormone is probably an underestimate. It's probably more like 200 genes. So that's essentially an activity for every gene. So we're talking like 50 to 200 different things vitamin D can do. So just to sum up with 5 things, of course, it's a very short list. Otherwise, we would be here till twilight discussing all the things that vitamin D can do. But we know it's important in calcium balance, and we now know a lot about how important it is in immunity, cell differentiation, which has a lot to do with cancers, even insulin secretion, and lo and behold, even blood pressure regulation. Okay, traditionally we have the understanding about how vitamin D helps regulate calcium. It helps the intestine absorb more calcium and phosphorus. It helps the metabolism of bone and cartilage. It helps the reabsorption of calcium in through the kidney. And one of the interesting things is you can put an animal on a no calcium diet and it will maintain the calcium level in its blood serum because of all these mechanisms that kick into place to pull it out of the bone. And part of this is through the vitamin D control and something called parathyroid hormone. So if you have low calcium levels or vitamin D deficiency, you'll make more of this parathyroid hormone, and it kicks in and gets the more calcium being taken in from the gut, more reabsorbed from the kidney, and that big skeleton that we have is just a nice calcium reservoir, and it'll pull it out of the bone. So in other words, you don't want to have a deficiency because you want to keep your calcium in your bone. And that's how vitamin D got discovered, because of the phenomena called rickets, which is soft bones, where little kids, as they were growing, when they didn't get enough vitamin D, their bones were so soft they got these bowed legs, and that was very typical of rickets. And in adults, that same phenomena is called osteomalacia, where you get very soft bones, and the characteristic was bone pain as well as soft bones. So you might ask yourself, I wonder if vitamin D would be helpful in bone pain. Yes, it is. That was one of the first things they discovered. Somebody said, well, let's give people vitamin D for bone pain, and it helped. Okay, so vitamin D, as we know, helps the body absorb calcium. So if you have a vitamin D deficiency, you're only going to get about 10 to 15% of your calcium absorbed. So they did some pretty neat experiments where women up in Boston were given vitamin D along with calcium, and one group got 700 IUs of vitamin D and the other group got 100, and there was a lot less bone loss in the group getting 700. And one other study I want to point out is that when they looked at risk fracture in the elderly, if they supplemented with 800 IUs, they found decreased risk fractures. Decreased risk of fracture. Okay, now what's important about this? Okay, look at how much it took. 700 IUs and 800 IUs. Okay, what's the RDA? 400. So we're looking at an effect that's at least requiring double what has been the RDA for years, the recommended dietary allowance. So what does that mean? That means that when you have a supplement where it has vitamin D in it, it should be D3, and it says 100% of the RDA, you're still only half where you need to be. Okay, and like I said, it's just vitamin D is not just for bones anymore. It's important in muscle weakness, autoimmune things like multiple sclerosis, diabetes, and insulin resistance, even gum disease, arthritis, both the rheumatoid and the osteo, depression, polycystic ovary disease, seizures, and cancers. And let's just talk about the phenomena of vitamin D in cancers for a minute, because that also has been getting a lot of good publicity lately. Like so many things, of course, they start out studying animals, and the phenomena of adding vitamin D to help animals resist their cancers that they have been given. They found that vitamin D supplementation helped to reduce all kinds of tumor growth, and they found less cancer cells were abnormal. The less cancer cells were likely to multiply. They were more likely to die, and they could also, with the vitamin D, hinder growth of all those blood vessels that are necessary to feed a cancer. So they advanced to looking at people, and they just took a big group of men that were in this health profession study, and looked at what happened with low vitamin D levels. And they found both the increase in mortality that we had talked about in the beginning, which means death, but they also found an increased incidence of cancers. Okay, that was found in a study with men. And then in Nebraska, they actually went and looked to see what the effect was on women. And this was a study where the women were getting both calcium and they were getting vitamin D. And then one group was getting calcium alone without the vitamin D, and then one group was getting placebo. So they were looking at other things, and then lo and behold, after 4 years, they found that in this group that was getting vitamin D, it reduced all types of cancers. 7% reduction versus 3% in the group that were just getting the calcium and the vitamin D. I mean the calcium alone. So their synopsis was that they'd get a 35% reduction in cancers for every increment increase in the circulating vitamin D levels. And that's what's going to be important when you're trying to figure out what the adequate vitamin D level is for you, is you need to know what your level is and what is going to take to actually improve it. And again, remember in those other studies, they needed 700 to 800 international units to get an effect. In this group, they had to have 1,000 IUs a day of vitamin D to get an effect. Now, reduced cancer risk for specific cancers has been pretty well understood with the colon cancers, there's pancreatic cancer reduction, the breast cancer, and then in prostate, I just want to mention that they found a 50% decreased risk in men who spent more time out in the sun. These are like observational studies. And then they found in the petri dish that the ability of prostate cancers to spread, divide, and proliferate was increased if there was a vitamin D deficiency. And then somebody did a very small study that I thought was really interesting. They gave fellows that already had prostate cancer 2,000 international units a day of vitamin D, and after 20 months, 14 out of 15 had their PSA go down. Now, colon cancer, like I said, and vitamin D, that relationship's been understood for a while. We've seen a lot of studies where they use vitamin D and calcium, and they find it inhibits those precancerous changes in colon cells, where a colon cell might go from almost cancerous to cancerous, and that when they get vitamin D and calcium adequate, it helps to inhibit the spread of colon cancer. So somebody did a big, what we call meta-analysis, where they look at a whole bunch of different studies using vitamin D or studying vitamin D and the effect on colon cancer. And the higher the levels of vitamin D in those folks, the more protective it was. In fact, there was a 2/3 reduction of the incidence of colorectal cancer when vitamin D levels were above this amount. And this is 46 nanograms per milliliter. And the reason I point that out is those are the amounts that we measure here. And those are fairly common nanograms per milliliter. So when we're kind of looking over evidence here, those are going to be the levels that you're going to be looking for in your own blood levels. Now, there are some labs that measure nanomoles per liter, and I'll show you how to translate that so you can do the math when you're looking at your own levels. Okay, now, a lot of new evidence about breast cancer. Vitamin D was very protective in women who were premenopausal. The more calcium and vitamin D they got, the less likely they were to get breast cancer. Now, it took more vitamin D to have that same protective level in postmenopausal women. And their average level was at least over that amount, which was about 500 plus. And the importance of that is, as we get older, we don't make vitamin D as well. So that's part of that explanation. Now, another study that was looking at breast cancer risk and vitamin D found that the risk of breast cancer went down as the levels of vitamin D went up. And in order to reduce the risk by 50%, they hypothesized that you would need about 2,000 IUs of vitamin D every day, or 10 to 15 minutes of sun. And of course, that's probably sun at the equator, not sun here. And then they looked at women who already had breast cancer, and they studied what their vitamin D levels were, and they found that 3/4 of the women with breast cancer that they studied had vitamin D deficiencies. And if they had those vitamin D deficiencies, they were more likely to die of their breast cancer, and their breast cancer was more likely to spread. Okay. Well, cancer has many mechanisms, and inflammation may be one of them. Inflammation covers even heart disease, and inflammation also covers infectious organisms. And vitamin D is actually helpful in inflammation. And what's really interesting is there is a skin protein that has antimicrobial activity. In other words, it kills germs, that is increased when we get adequate vitamin D. So that's one of the hypotheses, that things like influenza epidemics and winter colds happen during that time of year, that is the winter, when we're less likely to get vitamin D, because we don't have this protective skin protein that is helping our immune system. Vitamin D can even signal macrophages, which are a part of our defense system, to kill tuberculosis organisms. And where did people get sent to recover from TB in the old days? Someplace that was dry and sunny. Now here's was something interesting. Somebody took genetic twins, and the ones that had the higher vitamin D levels had an improved genetic measurements. These were fairly fancy genetic measurements, but they had better genetic measurements against inflammation and chronic stress. And they even calculated that with the lower vitamin D levels, that was equivalent to 5 years of aging. Now, one of the things that I talk about in my osteoporosis lecture is that the main thing you want to not do is not fall down. Because to get a fracture, you have to fall first. Okay, so if you don't fall, you're going to be okay. Well, what's important to not fall? Well, getting adequate vitamin D. It actually reduces the risk of falling. And they found that older people who have higher vitamin D levels had better muscle strength and balance. So somebody got to looking and found that there was increased protein synthesis, actually muscle growth, in older women when they gave them vitamin D. And then somebody took a look, and a bunch of studies that they had looked at trying to reduce hip fractures in elderly, and they found that if they gave them 700 to 800 international units a day, they had a 26% lower risk of a hip fracture. Now, remember, this is again that higher level than what people may be getting in their multivitamin, that's the RDA of 400. And again, here was a level of 800 IUs per day, along with some calcium, And they had a group that got the vitamin D and the calcium. They had a 50% decreased risk of falling compared to the group that just got calcium without the vitamin D. So like so many nutrients, it's that teamwork approach that really helps them work their best. So that's helpful with muscle tissue and balance. And vitamin D is very important to modulate or regulate or run the immune system. And we had talked a little bit about the macrophages that go after TB, and how helpful it is in infection. But inflammation is also at the heart of things like asthma and things like autoimmune disorders. And this autoimmune disorders encompass a lot of different health phenomena. And the vitamin D can have a very big role in regulating our T cell responses. Okay, so what is an autoimmune disease? Well, it can be irritable bowel. Actually, celiac is an autoimmune. Type 1 diabetes, autoimmune. We talked about multiple sclerosis, briefly mentioned it. That's autoimmune. Rheumatoid arthritis, lupus, the list kind of goes on. And they have found that both the calcium and the vitamin D are very important in regulating those autoimmune responses that are seen in the GI tract and the nervous system. So there's a little bit of that regulation going on. Okay, multiple sclerosis. When I was studying, and I think it was medical school, not residency, did a neurology rotation, and the professor there was from closer to the equator, and he had a theory about multiple sclerosis because it's observed more common in the northern latitudes. And instead of thinking in terms of like the northern latitudes not getting enough sunshine, he thought it was probably because North Americans allowed dogs to live in their house. I'm not making this up. Okay, but you have to think outside the box. It had a lot more to do with sunshine. And they, sure enough, in mice that they induce experimental multiple sclerosis, they find that vitamin D reduces their autoimmune response, which is what propitiates the multiple sclerosis. And women who have those sensitive skin types, what they call always burns, are at less risk because they're making more vitamin D in their skin. And then they found a 40% lower risk in women who were taking even just the 400 IUs of vitamin D a day. And they found the risk for multiple sclerosis decreased, again, the higher the levels of vitamin D in their blood. Okay, and then another autoimmune phenomena is type 1 diabetes. Usually develops in childhood, and they found that children with newly diagnosed type 1 diabetes had lower levels of vitamin D. And then they turned around and duplicated it in mice and found that the amount, if they gave the mice vitamin D, they could decrease the incidence of the type 1 diabetes that they were trying to induce in the mice. And then somebody went to Finland, and over 30 years, they looked back at what had happened to the babies 30 years prior. And those who got vitamin D supplementation in that first year of life were less likely to develop type 1 diabetes. And those kiddos who had been followed for rickets, which of course is the severe deficiency of vitamin D, also had a higher risk of ending up with type 1 diabetes. And, of course, the more common type of diabetes is the type 2 diabetes. And vitamin D may improve insulin sensitivity, which is affected or lowered in type 2 diabetes. And a low vitamin D level is also associated with an increased risk of metabolic syndrome. And that's where the triglycerides are high and the blood sugar's a little elevated. There tends to be more abdominal fat. But I thought it was interesting in Australia, they found that the better the vitamin D level was, the lower the fasting glucose level in the women they studied. Okay, then there's arthritis. There's the two kinds. There's the rheumatoid, which is the autoimmune phenomena, and they found that women who got less than 200 IUs, which that's not very much, were 33% more likely to get rheumatoid arthritis. And even osteoarthritis, which is the wear and tear, seems to be improved with vitamin D because they had better mineral density in their knees. And they were less likely to have progression of their osteoarthritis because the low vitamin D levels seem to promote loss of cartilage and more bone spurs, which can be problematic in pain of osteoarthritis. And we're just touching the few high points of all the things that vitamin D can do. And let's not leave out the skin. Psoriasis has been treated with topical vitamin D ointments for at least since 1994. That's when a pharmaceutical company came out with something that the dermatologist could prescribe. And they've been using UVB phototherapy for a long time to treat a number of skin conditions, but psoriasis it's very helpful with. In fact, the best level of circulating vitamin D that I've ever seen here at the center was in a young woman who had psoriasis, whose dermatologist had ordered these UVB phototherapy sessions, and she was really cranking it out. And she also was getting much better. So, I was impressed with how much it took to get those levels up. So we really have to kind of work at it. Now, some women's health issues. Low vitamin D is also associated with infertility, and premenstrual syndrome has been treated with a combination of calcium and magnesium and vitamin D to improve those symptoms. And then something called polycystic ovary disease, especially when it's accompanied with obesity and insulin resistance, is also seen when there's low vitamin D levels. And there was this really small study where they very successfully, with vitamin D and calcium, normalized 9 women's cycles who had polycystic ovary disease and problems with that. Okay, unless we leave out our big tissue up here, vitamin D and the brain. Remember, the brain is largely a big glob of fat, and vitamin D is a fat-soluble vitamin. And we have receptors for vitamin D in the brain, and these proteins affect learning, they affect memory, motor control, and behavior. So I think there's going to be more research on vitamin D in the brain. What we do know is think about the wintertime depression that's called seasonal affective disorder that a lot of folks have treated with light boxes. Well, what's that light doing for them? It's making vitamin D. But somebody did an experiment where they took folks with the seasonal affective disorder and they supplemented them with vitamin D, and the other people were getting the light box. The people who were actually getting supplemental vitamin D did a lot better. So a good way to treat the winter blues. And they've also found that in elderly folks, if they have depression, they find low levels of vitamin D. And someone got smart and said, okay, well, we'll actually supplement vitamin D and see if thinking actually improves in addition to mood, which it did. It's what we call cognitive performance. So one way to get smarter. Okay, and you wouldn't think that, you know, the teeth. Okay, vitamin D helps the teeth as well. And the gums. Inflammation of the gums in elderly is the leading cause of tooth loss, and low vitamin D levels are associated with gingivitis, which is inflammation of the gums. So somebody got after that and studied it in a group of people, gave them 500 milligrams of calcium and 700 of vitamin D, and they had 60% less tooth loss in 3 years. Now that's pretty significant. Everybody likes to hang on to their own teeth. Now, blood pressure. Okay. This was a study where they had calcium and they had vitamin D, and they gave them 1,600 IUs of vitamin D and 800 milligrams of calcium for 8 weeks, and they actually lowered blood pressure. This was a study in elderly women. And then over in the Netherlands, they found that what they did is they exposed people to UVB radiation. They increased their vitamin D levels, and they were able to decrease their what we call 24-hour ambulatory blood pressure. That means over the period of 24 hours, their blood pressure was more in the normal range. So who would have thought? Vitamin D and blood pressure. Well, that brings us to cardiovascular risk, which we talked a little bit about being in the news more this year. And if you look at a whole bunch of folks that are in these nutrition studies called the NHANES participants, they looked at 15,000 of them and documented those that had the lowest vitamin D levels were 30% more likely to have hypertension, 98% more likely to have diabetes, 29% more likely to be obese, 47% more likely to have high triglycerides. And then another study found that low vitamin D was also associated with peripheral artery disease, where you have poor circulation in your extremities, mostly the legs. So, are we getting enough vitamin D? It's relatively rare in foods. And the further we get from the equator, the ultraviolet that we need is scarcer. And ultraviolet rays that come in at an angle and get absorbed by ozone, you have smog and cloud cover that interfere with getting enough UVB for your appropriate sun bath. And they find that November through February in the Midwest, that's including us, and northern U.S., you just can't make vitamin D. Not enough sun at the right angles. Latitudes above around 40 degrees north. I found another paper that said any latitudes above 35 degrees, just forget it. In the winter, we're not making vitamin D, and we are at 37 degrees latitude. So, and I do see low vitamin D levels when folks, Kansans, Midwesterners, come in and get them tested. Unless they're hanging out at their dermatologist getting a UVB treatment, they are not very stellar. And then the peak rate of getting your sunshine is at 12:30 in the summer. Now, all things are not created equal. Even if you are standing out getting a sun bath, because if you have pigment in your skin, you are not going to make vitamin D as well. And we actually find that 42% of black women have very low vitamin D levels compared to 4% of white folks. So what that means is this melanin in the skin, which is very protective for skin, preventing the sun rays, is also preventing those sun rays from making vitamin D. And so the darker your skin, the more likely it is that you're going to have trouble making adequate vitamin D. And they found that for darker skinned, these were African descent folks, it took 5 to 10 times the sun exposure to get a 30-fold increase in their vitamin D than those who were the always burn type, what it took for them to get a 50-fold increase So lots of variables there. So skin color makes a difference and age makes a difference. We just don't do as well as we get older. 20% less vitamin D at 70 years than a 20-year-old with the same sun exposure. Okay, and then what are we so good at inflicting on ourselves? Clothing and sunscreen. Well, of course, you don't get vitamin D, or you don't get those UVB rays through your clothes, and sunscreen blocks out most of it also. And your tinted windows in your cars. That's also blocking it out. So all those variables. And then if you're eating or taking supplements of vitamin D, you may not absorb it. That will put you at risk. And then I had mentioned that increased body mass index or increased weight, obesity, is a risk factor for having low vitamin D levels. And that's because the vitamin D goes and gets stored up in the fat cells, so there's less vitamin D circulating around that can be used by the tissues. And interestingly enough, exclusively breastfed infants, unless they're out in the sun and getting their little sun baths, they're also at risk. And so the Pediatric Association has a recommendation for vitamin D supplementation in babies. Okay, so what should we be taking? Well, the adequate levels since that were set in 1997 said 200 to 600. Those don't apply anymore. We're going to have to wipe the slate clean and redo those levels. Because if you look at all the evidence, it's going to be at least 800 or more units of vitamin D to get some of the therapeutic, and even maybe more, some of the therapeutic benefits that we discussed. Now, they say if people are living in a temperate climate, they may be able to take that much and get a good level of vitamin D. That's temperate climate, meaning assuming they're able to get some sunshine also. Now, here's the good news. Okay, a few minutes of this high noon, hot summer sun can produce 10,000 to 20,000 international units of vitamin D in just a few minutes. Okay, so the body will make a lot of vitamin D. And the really nice thing about getting it in from your sun bath is there is no risk of toxicity with vitamin D from the sun. In fact, toxicity is a little overstated. Vitamin D toxicity is called intoxication. And they've recreated it in animals where they create a condition called hypervitaminosis D, and it causes hypercalcemia. Now, people who have problems with regulating their calcium should follow their levels of vitamin D carefully. And those are people that have the parathyroid working too much, a condition called sarcoidosis, the TB folks, because they make little calcified granulomas in the lungs, and perhaps folks with lymphoma. And the high levels of vitamin D they see in animals are characterized by kidney stones. They just don't see it today. They've had, I searched the literature for some report, and it's just not seen today. There may have been some accidental poisonings with high doses of vitamin D where folks got kidney stones, but it's rare. And when they start looking at the levels of vitamin D, because in these studies they're shooting for levels of vitamin D that seem to be the most healthful benefit for like preventing the cancers and helping with blood pressure and all those, you'd have to get a level that was 200 nanograms per mil or 500 nanomoles per liter. You'd have to get way over that to really see a toxic level, and that's a pretty high level. They were looking at optimal levels in the 52 range in those studies. And then again, like I said, sun exposure will never cause toxicity. Okay, so what are we shooting for here? Well, they say if we're healthy and we're getting exposure to sun, that we should have a level of like 40 to 70 nanograms per mil. This is the vitamin D, the 25-hydroxy vitamin D that you'll have measured in your blood. That's the level of 40 to 70. That's healthy people working out in the sun. Those are their healthy levels. And if your lab where your doctor's getting your level reports nanomoles per liter, here's the little equation. 1 nanogram per mil equals 2.5 millimoles per liter. Because, like I said, different labs will have different ways of measuring it. Okay, but the recommendation is we probably need higher levels if we have one of those chronic diseases associated with vitamin D deficiency. Well, that could be diabetes, that could be hypertension, that could be anything from multiple sclerosis to psoriasis, any of the cancer, trying to prevent cancer, cardiovascular disease. You really want to shoot for this higher vitamin D range. Okay, so interestingly enough, that one of the other measurements that the powers that be tell us is appropriate for supplements is called the upper limit. And they think the upper limit is 2,000. Well, that's very conservative. As we see, it sometimes takes a lot more than that to get to these therapeutic levels. And it isn't a linear relationship. If you're very deficient in vitamin D, you can take an amount that will make your level go up like this. But once you're up here, that same amount is going to only make your level go like this. So it's not like you can take more and more and it's just going to shoot up. There's a point where it's going to level off, and that's why it's important to go ahead and take your level and see what your measurement is. And they really think it's very unlikely anybody would get in trouble with even intake levels of 10,000 units a day, even though they put their upper limit at 2. Okay, just a few caveats about how to get your your D with the sun. Again, it just takes a little bit of exposure. You don't really have to be buck naked. You just have to expose your arms and legs and your face and arm. And they say 3 times a week, high noon again, 11 a.m. to 2 p.m. That needs to be summer, really. And 42 degrees latitude, so you may have to drive to, I don't know, Texas or someplace. And if you're light-skinned, you will have a better chance making more vitamin D than if you're dark-skinned. But even if you do get adequate vitamin D over the summer, your levels will drop over the winter. They looked at fellows who were working on the equator, and the levels that they got up to during their summer fell 50% over the winter. So that's, and they were on the equator. We're in Kansas. We're not going to have the benefit of getting vitamin D type sun over the winter. Food sources, they're nice, but they're a little on the low end. It's mainly vitamin D comes from animals, so it's fish, fish livers, and then you see the numbers sort of trail off with like an egg. Even a beef liver doesn't hold a lot. The cod liver is a lot better. So what do they do these days? They fortify a lot of foods with vitamin D, but it's still not a whole lot. If you find it in milk or orange juice or any of the dairy products, it's still a small amount of vitamin D. So there's 3 ways to get your vitamin D. Through your diet, through sunshine, or through the UVB radiation. So and you can enjoy your fish, but I also suggest that you might enjoy some vitamin D3 supplements and have your levels measured to see if you can get to those therapeutic doses that are very helpful in all these conditions that vitamin D affects. And then sometime soon we will have some good sun for making vitamin D. Thank you. I'm glad y'all came today.
Okay, we have time for a few questions, and we'll bring a microphone around so you can ask those questions.
I have a question about using this sun. If we can't drive to Texas every noon and we want to, can we stay out 15 minutes, but that would have to be without protection, some protection of some sort?
During the winter, they say the sun is just not coming in at the right angle to make vitamin D.
In the summer?
Oh, in the summer. No, you're okay in the summer. It may take a little bit more exposure. Now, driving to Texas may not help because my sister in Houston had really low levels of vitamin D, and she is an air balloon pilot, so she's out a lot. But guess what? Houston has a lot of what?
Smog.
Smog. Yeah, so she wasn't making vitamin D. Well, we were both amazed.
Yes, the fortified food sources, do they have the D3 in them?
Well, I tell you what, it's worth a careful read on your label. Because I have seen sometimes some manufacturers are still using D2. And then you can't, if it says 400 IUs of D2, that's not near what you would get out of something that said 400 IUs of D3. So, yeah, you got to check your labels because they're going all over the place with that. Oops, okay.
Can you get vitamin D from tanning booths?
Yeah, if they are UVB. So you have to know what kind of ultraviolet radiation they use. And the dermatologists say that some of those are not the right kind. So it's, consumer beware.
Is there any advantage to the dosing time for vitamin D, like in conjunction with sunning? To work at night better than during the day?
Oh, when you actually take a supplement?
Yes.
Nobody's studied that. It's a fat-soluble vitamin, and it's got, all these different paths to go through. So just the fact that you can get it in hasn't seemed to matter what time of day. Yeah.
How did the Stone Age people that lived in the Northern Hemisphere make it without supplemental vitamin D?
Well, you know what they did? They lost pigment. Because if, we started in Africa with lots of pigment, and that protected us from the light rays. And then as people migrated north, they needed vitamin D, so they lost that pigment so they could make more vitamin D. And you get some of those really northern people, like the natives in the Arctic, they ate things like seal liver. So they were getting vitamin D there.
Comment. My mother was Swedish. Oh, okay. My mother was Swedish, and I grew up on a tablespoon of cod liver oil every day. But the question was, are vitamin D supplements always with calcium, and can you get too much calcium if you take more than, say, 600, 400 calciums?
What you probably want to do is think in terms of vitamin D by itself. Because what I find is right now a lot of the calcium makers are still putting those really low levels of vitamin D in their products. So they're searching for that amount of of the calcium they think is good for us, like is 1,500 milligrams, although that's debatable. But they're still only putting 400 of the D in it. So you're really going to have to take extra D unless you find a supplement that has a lot more D in it with the calcium. Now, and the cod liver oil your mom gave you, that was smart. Let's see.
Yes, how is osteomalacia, and is there more than one way to diagnose?
Osteomalacia is actually an adult vitamin D deficiency. So they mainly look at X-rays, and you don't see that diagnosis as much anymore. Just kind of like you don't see rickets. Doesn't mean it's not out there, but yeah, that is kind of the adult form of the severe vitamin D deficiency. Yeah.
With regards to children, and especially to help boost their immune system, is it okay to? Has there been any research to supplement small children with vitamin D, and what's the dosage that you can take?
Yeah, the recommendation I saw, let's see if I wrote that down, it was like around 200 international units was perfectly okay with kiddos. Mm-hmm. Yeah. Yeah. Mm-hmm.
I have a question about the ratio of vitamin D to calcium. Is there such a thing, if I'm taking 2,000 of vitamin D, what would the ratio be of calcium, or is there no ratio?
No, it's not so much the ratio that's important, since it's the amount of vitamin D that your body needs, which you'll find out by when you actually measure your circulating 25-hydroxy vitamin D. Well, okay, one more question, and then we'll draw for a free lunch and lecture.
What is the source of the vitamin D3 that you get in a supplement? Where does it come from?
Well, some of it is made, some of it is extracted from fish oils. A lot of it is, and then some of it is a process where they take a derivative of cholesterol, and they shoot it with UVB, and they make D3. But I find a lot of it, since I'm sure this is the less expensive way, comes from fish oils. Mainly the little cod liver. Yeah.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.